Join us on August 24th at 10:30 a.m. Eastern. Dr. Frank Song, a naturopathic doctor out of Vermont and Connecticut, and I are going to be talking about Lyme disease and what it's like to go through treatment for Lyme. We'll talk about kind of testing and the inconsistencies around testing and basically just answer some of the questions that I know you have if you have either experienced Lyme disease yourself or have loved ones who have it. So please click the button in the show notes and that will take you to the registration page. There will be a recording that goes along with this, but joining live means you get to ask questions to Dr. Song and I. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learned here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Sara Kouten is a psychotherapist who specializes in working with patients and caregivers who have been affected by cancer and chronic illness. Sara is a 2-time cancer survivor and the mother of a young adult cancer survivor. It was during her own struggle with cancer that Sara realized that the psychological aspect of life-altering illness was not adequately addressed. It was then that she returned to school to pursue her master's in social work and became a licensed clinical social worker. Sara began her career working in an inpatient geriatric acute care hospital where she worked with patients and families affected by mental illness and dementias. Currently, Sara owns Safe Waters Therapy and sees clients in private practice via telehealth. She hopes to incorporate walk and talk therapy for established clients in the future. Thank you so much, Sara, for being here and for being willing to share about your personal story. I think it's so powerful when we do share as the helping professional, lets people know that we get it. So,
Yeah, that makes the world of difference.
yeah, I would love to hear, maybe we can just start there, where your story kind of begins and then, yeah, how that led you into this field.
Okay. I can go even way, way back. We were talking a little bit about this before. I am a two-time cancer survivor, but I have undifferentiated connective tissue disease, which stemmed from originally finding out I had osteoporosis like in my 30s. And
Mhm.
in finding that, we started exploring other things. And the question came up, doesn't everybody have pain in their 30s? That was kind of, what was presented. And they said no. And then they started doing all the blood works and found out I had these other things. And so it's often that we're just kind of dismissed. That was the beginning of the pattern of just being dismissed, until I finally found somebody who would listen. Because, I had chronic pain. I had a lot of doctors in the past say, oh, it's nothing. Don't worry about it. Until I found one that said, wait, no, this isn't normal. Fast forward, I was 40 and I was diagnosed with breast cancer with no family history whatsoever. Yet I did find out at that time I also carried the BRCA gene. And for those who don't know what that is, that's the genetic mutation that gives you like an 80% lifetime chance risk of getting breast cancer. And it also has a higher than average risk for ovarian cancer. So all this kind of happened right when I was 40. And I was kind of paralyzed by fear. And I remember speaking to my oncologist about it. And she was just kind of like, you're fine. Just go see a psychiatrist. And she just kind of blew me off.
Mhm.
And I mean, that was a while ago. That was 2008. Things have changed. They've gotten better, but that's really what inspired me to go into this field. Excuse me. Um, I just knew there had to be a difference, and I connected with a lot of advocacy groups and nonprofits because it took a little time to get to the place where I was going back to school and getting my master's. But young people too, especially young women with breast cancer or other cancers, it's different. it is just different getting cancer when you're younger than when you're older. You're still looking at things like fertility, careers, jobs, families. When older people, not that it's not difficult for older people when they have cancer, but they're not as usually navigating their careers. They're not usually navigating fertility and things like that. It's kind of, I don't want this to come out wrong,
Yeah.
but it's a little bit more expected when you're older. When you're
Yeah.
younger, it's like you're kind of blindsided,
Yeah, so right there's just the
you
trauma
know?
of being blindsided, which I mean, granted, yes, anyone I think at any age, anyone can be blindsided, but yeah, when you're trying to figure out your career and you're trying to figure out motherhood and you're trying to figure out things that happen in your 30s, a life-altering illness is it's extremely traumatic and huge, yeah.
Yeah.
So I get it. I mean, I get yeah, it doesn't
Yeah.
dismiss just talking about the differences.
Yeah. And being the youngest person in the waiting room, you
Mhm.
know? I mean, fast forward, I had a recurrence in 2022, which was after I already went into this field. So that was kind of interesting because I always was fearful that I would have a recurrence, but then I kind of let it go through my own process. And that's why I wanted to help other people process it. And then I did have a recurrence. So it's like, oh, okay, wait, here we are. But it was a different experience this time around because I had worked through it. And, it was just, but I'm still, now I'm not 40. I am 56, still the youngest person in the waiting room, still, even at 56. So that's a whole nother experience. But along the way, I also, one of my children at the age of 18 got diagnosed with stage 4 Hodgkin's lymphoma, turned 19 in the chemo chair. He's fine. That was in 2016. But being a caregiver is a whole nother experience too.
Can you
And I actually
speak
found that harder than being a cancer patient.
can you say a little why that
So
was harder?
well, there's a lot more powerlessness associated with that. When you're going through cancer treatment yourself, you're going through it. You're doing something. And I'll talk a little bit more about that later if I have the opportunity, because that's a whole nother thing in itself. But when you just have to watch somebody go through it and you just have to be there and be their support. And he was 18. He's still living at home. He was in his first year of college. He's still my baby. And he was my youngest too. And I wanted to take control because I knew all this. I knew it. I've been through this. I know all this stuff. So this is how you should manage it. And from my own experience, I knew that there's such a feeling of powerlessness that you need to have as much control as you possibly can while you're going through it. So I had to step back and let him have the power, let him have the control. I made sure the doctors were talking to him, not me, because he was an adult and he needed to have that control. He needed to have the decision making power. There were things that he decided on that I didn't necessarily agree with, nothing critical, but things like to get a port or not get a port. And he decided not to. And I had to let him make that decision. I had to stand back and let him do that. As much as a mother wants to fix things and make everything right for her child, he needed to have that. And he appreciates that. So
Yeah, I'm sure.
it's such a powerless experience. And the chronic illnesses are really,
Yeah. Yeah, I think that's the whole point of this podcast too is like seeing the themes um between all of these different chronic illnesses. It's yeah, we all have our different specialties that maybe illnesses that we know a little bit more about and we talk about the differences but not because one is worse than the other. It's just because that's our
right.
experience, right? But the emotional threads throughout all of it is the same.
Yeah, definitely. Being faced with your mortality, at any age, at any illness, when you're in pain, you feel like you're going to die. You feel like you're not going to go on. So there's that mortality piece. There is, and it's huge that you said not that one is better or worse. More, it is what it is, and it's your reality. And what you're going through is the worst thing when you're going through it. There's no comparison. And I find people do that sometimes, instead of trying to identify the common threads, they compare the differences. And I try
Yeah.
and take that away. And
Yeah.
because it's all, it's what's real for you. And when I have had people say, well, that person only had stage 1 cancer. I had stage 3. And, that person only had radiation and not chemo. It's like, no, it's everybody's experience is everybody's experience.
Yeah.
Yeah.
What I hear with that is like, I want to be seen
Mhm.
in how much this hurts, right? And we are such a cognitive based society. So our brains have to like make up a story of why it's better or worse, or like there has to be like this cognitive reasoning to make it make sense. Because, like you said, this is the worst experience I've ever gone through, you've ever gone through, even if those two experiences, maybe one is only half the severity, not that you can measure it that way, but for the sake of an example, um, yeah, it's your worst experience. So when clients are saying like, yeah, well, I have this and you can't possibly understand because you only had this. It's like, I need you to see me and how much this hurts. So, yeah.
That's a lot of what I do is validation, you know? And it's different. And I know this from experience that, you can have a social worker or a therapist, the hospital social worker who hasn't been through it. And they just kind of nod, oh, yeah, I understand. But do they really? And that's a lot of what I'm doing is saying, yeah, what you're feeling is valid and real. But let's try and look at it this way. You know, this is what's happening. It sucks. It
Yeah.
just does. And I'm not gonna, be toxic positive, use a lot of toxic positivity. I'm really about acceptance. Like, yeah, this happened. And yeah, we're afraid of X, Y, and Z happening in the future, whether it's fear of recurrence or, whatever the fear is. Well, what would happen if that did happen? Let's look at the pink elephant in the room. I mean, depending on the person, obviously. But I've worked with people who were end of life, and they had family members that were, utilizing what is called, the toxic positivity. Keep praying, the miracle will happen, you will survive. She had metastatic disease that was affecting all parts of her body.
Yeah.
So let's face what we're going through
Yeah.
so that we can not be frozen in the time that we do have left. Does that
Absolutely.
make sense?
This is
Yeah.
a little bit
And it
off
sounds
topic.
harsh, but
No, no, that's yeah, absolutely.
hmm,
I'm noticing sorry, one, I'm noticing there's a lag and I don't know why. But hopefully I don't think I can stop this and make it work better. So I think we'll just have to keep going. But yes. Okay, cool. Thank you. I was gonna say it's still on topic, but pivoting into is there something you recommend for folks who are going through you're working with someone who's end of life. They know they're going to pass away. Is there something you as the therapist do to help them, even if it's like giving an ROI to family for them to be able to talk to you after the death or not talk to you, or like any considerations like that that people might want to think about?
that's great recommendation, giving a release to family. I haven't been in that scenario where that's been a possibility. Um, but I do a lot of like, let's make sure your documents are in order, you know. I do a lot of psychoeducation in that. And I encourage so much journaling. I really do, because that's something tangible for the family afterwards. Maybe have two journals, one that's private that you hide away that you hope nobody finds, but one that, because you're not going to really pour your heart out if you're mindful that somebody's going to be reading it. So maybe have that private one that you can delete if you know, but to have something that you can journal in and be as honest as you can, also knowing in the back of your mind that someone may read that someday.
Yeah. Yeah.
That's something important. Um, I've worked with other people and they do better. And then I don't keep my clients a real long time. So it seems. And it's not that, you know, they're doing better is what happens. I think a lot of the work I do is short term because it's getting people over the hump. The chronic end of life scenario, um, they were doing better, and they kind of signed off for me and went on with their lives. And it was limited. And I did find out later that they did pass away, but that was one of the common themes. that we've talked about was, you know, being real with the family, separating from the toxic positivity and facing the reality, you know. Um, and I've had people tell me initially when they start coming to me that that idea of, acceptance of the reality of the situation seems harsh, but that's partly how I kind of got through it
That
my first time around.
Yeah, yes, I think that's great. I think the journaling piece is probably really helpful, like leaving journals for intentionally for your loved ones to read when you're gone.
Yeah,
Which might also, I'm sure, makes you I think it I would imagine takes you out of your own head in a way and gives you the bigger picture, and it does kind of help with
it
acceptance
does.
because what's going to happen is going to happen. We can't change that, right? And so what can you
Yeah.
do to make it a little bit better?
Yeah, I mean, cognitive behavioral therapy, of course, is based on reframing your thoughts so that you're looking at the truth. And sometimes a lot of therapy is about, changing your anxiety because it's not based on fact, right?
Right.
This can't be changed. This is fact. You can't change the situation. So what are we going to do with that? And that was like the big change in my life was when I realized, okay, and it's kind of crazy because it did come back, but um at that time in my life, I needed to just come to acceptance that, yeah, maybe this cancer is going to come back. And being paralyzed by fear and losing all this time in this fear place was jeopardizing the limited time. It wasn't placing value on the limited time that I may or may not, you
Yeah.
know? And it's a lot of that kind of a thing that, and it sounds negative, but it's the reality. I do believe thinking positive is a good thing, but not to the extreme of like, fairy dust. And,
Yeah.
I always, one of the catchphrases I always use is, I do not have a magic wand. I cannot make everything better for you. Let's talk it out and let's find the solution that works for you so that you can live with what you're going through. And
It's really
that's a lot of what I do.
It's really interesting because people love to talk about like not thinking too negatively, right? And then we try to reframe that. Don't think so negatively, but the opposite is true too. Like don't think so positively that it's one irrational, two like denies reality, and then that hurts everyone because you're not able to connect on this is the reality. Instead, now there's extra cognitive dissonance between like this is how I feel, this is what the reality is, but I'm supposed to think really, really happy thoughts right now, like, that's so damaging.
Yeah. Yeah, it is. Because it's not, because then if something bad happens, you're like blindsided, you know?
Right.
And, the reality is, you know, it was something like cancer, and cancer is the thing I know best, so I'll use that as an example. But any of the, there's so many different chronic illnesses that affect so many different people that have different recurrence rates, and but there's always once you have a diagnosis, it's not like check done, woohoo, let's have a party, celebrate survivorship, and I kind of touched on that before. When you're in active treatment, you're going down the road of active treatment and you're doing something and you're fighting and whatever. And I don't even like that term fighting and warrior and all this because does that mean if you don't win, does that mean you didn't fight hard enough? But there's just not good language. I don't know the good language around it. But people talk about the new normal and that's also language I'm not real thrilled with, but I don't have a better language yet for that. But the reality after you have a diagnosis like this is life has changed. It's not like check done and woohoo party. And the after effect is when a lot of people end up saying, "Wait, what just happened?" And then that's when the fear hits. That's when when the doctor's only seeing you in 6 months, not in 2 weeks, and they're kind of like, "Go live your life," and you're like, "What does that look like?" And then there's that piece of all the things associated with living your life, the fear, the anxiety of just being cut free. Every time you have scans and tests, the panic elevates. And we talked about that a little bit before. That scanxiety is what we commonly call that. Because it's anytime there's a scan, not only does the the anxiety increased, but somatic symptoms appear, you know? If a scan's coming up, it's like, oh, wait, I have this extra pain here. Maybe it's this. And it's so often it's associated and you can't ignore it ever. You have to report everything to the doctor. But there is a coincidence of symptoms that come up around scans,
That makes can you say more
and
about that? Yeah, like yeah, can we just talk more about and normalize that for people, right? Like it's okay if there's an increased pain in your shoulder or and yeah, you have to report it and I don't know what else comes up for you around that because I think that's an important piece of this conversation.
it's, there's not a whole other than it's normal. And yeah, maybe sometimes it is something, but a lot of the time it's not. And I'm not going to tell somebody not to go there because
Yeah.
the reality is you're gonna.
Yeah.
And by saying, so I had a conversation with somebody this morning, it wasn't a client. It was just a friend of mine who she was waiting on her mammogram result. And I did say to her, I know it's going to be okay, but your fear is valid. And I honestly thought about, should I even have said that I know it's going to be okay? Because that kind of takes away it kind of invalidates the fear a little bit. I know. So I was going to physical therapy for my shoulder, for example, we'll just use as an example. They said it was related to my radiation. They were pretty sure it's fine, blah, 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 blah. But it was this excruciating pain. And I was getting a PET scan as a result of it. I mean, it was kind of time for one. Every time somebody said, I'm sure it's nothing, it's just from the radiation, it devalues my fear, you know? And even though you want to be positive and instill positive thoughts and vibes and all the good juju out there, it does kind of take away from the validity of what you're feeling. So it's kind
Yeah.
of a dance, you know? I mean, I spoke to her about it and everything's fine and but it's hard to not say, I'm sure everything's gonna be okay. I'm pulling for you. I can feel it in my bones. I don't know anything. I'm not a
Right.
doctor. I don't know what her symptoms are. I'm just trying to be positive and helpful, and that can be perceived as not helpful. It really depends on the individual, you
It's
know?
good to hear you talk about it too, both
So
from your
yeah.
own perspective and as the person in the support role, right? Like that it's also human to try to go
Oh,
into that positivity, but let's be mindful about it.
sure. Sure. Yeah. So like I wrote in one sentence to her, I said, sure it's gonna be okay. But I know what the fear is totally valid. I
Yeah.
totally validate all your fear. And it just seems coincidental, you know. I'm not going to say most of the time it's nothing. But the other thing that happens a lot with scans, and it's really hard to and I help people get through this all the time, is once you get a PET scan, there's always a finding. There's always something.
Mhm.
A lung nodule, or which are usually benign, but then you have to start following that. Any scan, it's the radiologist's job to find things.
Right.
So now normal, just your body's aging, you had a cold once and it left a scar, whatever.
Yeah.
Sometimes it is something. So I'm always going to validate maybe it's something, but let's try not to go down that, rabbit hole. I've been on the wild goose chase hundreds of times, but I know people have gone on the goose chase and it turns out to be something too. So you can't
No, right.
invalidate it, but yet it's so normal. You get a scan, that means more appointments.
Yeah.
It's always something triggers, and then you end up with a bunch more appointments, which a lot of times is ultimately nothing, but sometimes it's not. So you're kind of like, okay, um, so you need to validate that as well, but yet manage the anxiety associated with it. So, and
Yeah.
that's where we sometimes go down the what if it is something,
I tend to go down the path of
you know?
with clients, or if I would do the same thing with a loved one, but like I will stick with you through all the testing that you want to do regarding whatever you want to do. If you are exhausted by the testing and you're doing this purely out of fear and there's no like reprieve from that, then that's when we can start to say like Okay, are you tired of the goose chase now? Like, what helps you feel stable and saying like, I am
Yeah,
tired of it, but I'm gonna be here with you through every test you want to take. Just know too, though, that test after test after test can also have negative traumatic responses for us. So, but it's your choice. Like, and I'll be, yeah,
yeah, because that's another thing we deal with is appointment fatigue, you know? The fatigue, and then also when you're looking at, like, breast cancer is the example I'm using, but other even gynecological cancers, I see men too with their different types of cancers. There's, people lose their, dignity through all that. The more doctor's appointments, you kinda just you lose the modesty, but that kinda takes away, your pride and just, it's just you feel violated and exploited at times because you got the fellows coming in, they're coming in copping a feel, the doctors are coming, you know what I mean? Like everybody's got to do the exam. And after a while, that gets exhausting too. With every test. And sometimes we want to tell our narrative and we want to tell our story, but sometimes it just gets old. Having to tell just read the chart already, you know? But that's just some of the stuff that everybody goes through, and you don't not everybody, but, the people it's a common thing. It's a common theme. And people just kinda a lot of times people just suffer in silence with that,
yeah,
and
yeah.
I
Let
refer to it as trauma. You
yeah. Trauma is too
know,
much
trauma.
for the nervous system. So it's too much for your nervous
Mhm.
system over and over and over and over again. Yeah.
Yeah.
I was really, really pleased in my last OB appointment. Um, I mean, I think pap smears are, I think, uncomfortable for everyone, but I cry every time I do. Like and it's not even like it's not a cognitive thing. I'm like totally fine. Yes, please, like do this. Make sure I'm good. But as soon as it enters, I'm crying. And so they were really, really nice. They were like, we should do a check as well, but like we don't have to do that today. You can, and she offered that consent, which without me even having to say anything, I really appreciated that.
And it's good. That's good. That
Yeah.
doesn't that's the one thing. So I had, surgical menopause when I was 40 because with the BRCA gene, you had to remove everything. And I was like, "Oh, yay, no more," you know, no more of that, but I still have to have all my see the doctors and get all my screenings and all that stuff, and having the recurrence, it's like starting it all over again, you know, starting all the, monitoring again, and it's fine. I'm gonna monitor actually more closely now than I did last time because I was lucky I found it myself both times, which also leads me to, just advocating for yourself. Um Both times it was in my axillary region in my armpit, but it wasn't a lymph node, but it was just, I guess, my breast tissue went all the way up. And so it wasn't anything that would ever be in a mammogram. So,
What
because you just
can
can't
you
put that part of your body there.
can you really say more, like visually explain that for people? Because even when she did the check on me recently, I have never had a check before or done it myself, which, is sad but true. And she checked my armpit and I was like, in my head, I was like, I literally had no idea. So if I didn't know, I'm sure other people don't know. I would love for you to kind of visually explain as much as possible.
Well, basically, your breast tissue goes all the way up into your armpits. So my basic advice is just know your breasts, know if you have any lumps. Um, Check yourself. There's a lot of cards out there. There's a lot of there's somebody, I can't think of her name, but I see her on Instagram. She actually has a system, a thing you can place over your breast to feel more properly. If I can find it, I'll send you separately the link. But it's just I tell everybody to just know their breasts, know
So
themselves. Um, I the
if
type of
you're
breast cancer.
basically if you're doing this regularly, because someone might be like, well, how do I know, right? But if you're doing it monthly or weekly or how don't you could tell maybe how often to do this, but if you're doing it regularly, then
Well,
you would know.
you find lotion. if you
Well,
apply
I guess that
lotion,
makes
you kind of know what feels like you. So mine, I had been getting actually mammograms just because my husband is very involved in the breast cancer community from his work. He was a big advocate, working with one of the nonprofits. And so it kind of made me aware. And I kind of always knew, kind of, I was very fibrocystic and all this stuff. And I had had a couple mammograms. They were watching a couple things which had nothing, they never turned into anything. I was just shaving my armpit one day and there was a lump there. And I shave my armpits like almost every day. So I'm dark. And so it wasn't there and then it was there. The second time, I had tried a new deodorant and I didn't like it. It was making me itch and I felt a lump. Same exact spot.
mm,
And I did have a mastectomy the first time around. But even with the mastectomy, there's never 100%. There's always a slight chance they're going to leave a little bit of breast tissue behind. And luckily, it was in the same spot because had it been underneath one of my implants, I wouldn't have found it and we'd be talking a whole different story right now.
wow.
So that's the thing. I mean, get your mammograms if you have family history, so you can get them earlier, but get your mammograms when you're supposed to. Don't avoid it. Yeah, it hurts, but so what? It's a couple minutes of pain. Suck it up. That's all, because finding it earlier is definitely better than finding it later. And avoiding it altogether because you're afraid, that doesn't mean it's not happening. So I know of people who have avoided the mammogram because they had something and they were afraid to get it checked. And doesn't mean it's not happening. It's still there. And if you address it, it's so true. The earlier you find it, the easier it is to cure. And the type that I had, which was triple negative breast cancer, and I don't want to get into the whole science of that, but basically it's a subtype that doesn't, it's not triggered by your hormones. It's just, they don't really know. It doesn't respond to three things that normal breast cancer does respond to. And it's very aggressive and it grows very quickly. And so that's why, even with mammograms, sometimes things happen in between mammograms. And that's why it's important to just know yourself. That's my
Yeah.
statement on that.
Yeah, yeah. I guess what I'm hearing is
But
like,
yeah, I mean,
because we might not put lotion daily, like, so, or, we might not do those things. And so if you are the type that just, or maybe you like very quickly and mindlessly, like, you might not notice unless it's super pronounced. But if you are intentionally making this a part of your practice once a week in the shower, I do like when I'm washing my, make sure when you're washing your body, just rubbing more and actually being intentional with feeling
yeah,
that area, then you're going to get to know it. And then you'll know when there's a difference.
absolutely. Absolutely. Just know your body, pay attention to it, you
Yeah.
know.
Which is a
Um,
core theme
I
of
think I
this
was always
podcast.
kind of conscious. Huh?
Which is a core theme of this podcast too. Just know your body. And that means like sitting with it. And when fear
Yeah.
comes up, we allow for the fear. Because if you don't allow for the fear, then you're not gonna be able to intuitively know your body either, because you're separating from it.
Right. Right. I mean, one of the themes I always say is you're going to feel fear. Fear is a normal part of life. Fear makes you act. The most important thing is not to live in it and not let it control you. And that's
Yeah.
where my work comes in, you know,
Yeah.
is to help educate and teach people how to not have it totally monopolize their lives.
You're right. Right. What are some of
So,
the things, and do
yeah.
you work from a more cognitive perspective? Like, here's how to use your brain to help you reframe these thoughts. What does that work look like? If I'm sitting here telling you like I'm terrified, and now my like, what are some avenues we might go down?
Well, we could talk about, what are the facts? What do you know right now? You know, what is the reality? Because we don't have a crystal ball. We don't know what the future holds. So I kind of ground them back into the facts and into what's safe. and where they are safely. Yeah, the past facts tell you it can happen, but the present tells you you're okay right now and you're in a safe place right now. And I kind of do work around that. I
Mhm.
also, if it's something that they just can, I kind of look at, well, what if? And I go down that road. What if? What does that look
So,
like?
yeah, I'm hearing it's really it's the exposure piece to the fear. Like, if you're able to sit in the fear with them, then they can
Yeah.
feel the fear and be okay at the same time.
Right, right, absolutely. And that's really, I mean, I had one client, it was right after I was re-diagnosed, and she was just getting past her recurrence. She's like, "I just want to process what this recurrence is." And I said, "Let's figure it out together." Because I use myself in my therapy all the time. I have no problem with that because it validates them, It's like, yeah, I'm not just saying I hear you, I really do. And it actually turned out not even being a big theme in her sessions. She had other stuff. And I encounter that a lot too. People think they want to come to me for cancer, and then we find out it's like other things altogether, boundaries and life and families and all that stuff. Um, a lot of some of the things we also talk about is the existential crisis. Okay, here I am, I survived cancer. My life really needs to be meaningful now. Like, I'm spared for some reason. So we look at things, we look at spirituality, if that's something that's relative to somebody, other people, that's one of the first things I ask is, do they use prayer as a coping tool? Do they believe? And if they don't, then we don't go there. But if they do, I bring that into the session. But like, look at our values and look at our goals and let's make sure they align and let's figure out what it is you really want to do. Some people really get through it and they think, well, I got to do this great, wonderful thing now. And it's not always true, but some people really, that's a thing. So and you don't have to go start a nonprofit
Right.
because a lot of people do that. You don't have to go back to school and get your master's degree and become a therapist. That's what I did. But you can just live your best life, but we need to explore and what that looks like too. And that's some of the things that we look at.
I
That's
think
a big theme.
it is interesting that you bring up, like, a lot of people do go on to kind of do greater and bigger things, and yeah, you're right, like, there's no it's not like you should or have to, but I think when you come that close emotionally or physically to death, it sparks something in you that wouldn't have been sparked otherwise. Um, I mean, even, like, within acceptance and commitment therapy, we have an exercise called the funeral exercise where you imagine yourself at your funeral and you imagine all the people who would be there and who would show up and what food you would wanna eat, what you would want served, and like, we can be silly with it, and we can also be able, like, "Okay, and what are people saying? Like, what did you accomplish? What what were you known for?"
Yeah.
Even if that it's just kindness. It doesn't have to mean, again, I started a nonprofit, but it's like, when I die, I want people to remember that I cooked fabulous meals and I was always laughing, or not always as in toxically, but, like, what do I want to be known and remembered for? So, yeah.
Yeah, yeah, I do. I bring that up. I don't necessarily use that context, but I think about there's a poem about the dash. You got your
Mm.
beginning date, the end date, and the dash in between. That's what's on your tombstone,
Oh,
and the dash is what really matters.
uh,
I don't know if you've ever heard that poem, but
no, no.
that's what we talk about the dash. Between, same ballpark. Yeah. And it's so
Love that.
important because I mean, there are people, and I respect these people too, but everybody handles things their own way. There are people that are like, check done, don't want to ever talk about cancer again. But they're still having little existential stuff or whatever. Some of those people come to me too. Or what I'll get is somebody will come to me and they're coming to me for a reason, whether it's the fear or the existential or just what happened. But they'll have concerns about a friend or a family member who isn't talking about it. Or the caregiver will come to me. I get caregivers come to me too, because their cancer survivor doesn't want to talk about it, doesn't want to deal with it. That's my son. My son is like, check done, don't want to talk about it. Why do you keep bringing it up, mom? You know, and I respect it. Everybody deals with it in their own way, and I help people to realize that, yeah, they're still processing what they just went through with their loved one, That doesn't mean they have to process it the same way that they do, and just finding that balance, you know?
Yeah. That makes perfect sense. Yeah, it's just respecting autonomy, um, which
Yeah.
is such an
Meeting people where they're at.
yeah, yeah.
Mhm. Yeah. Yeah. Yeah, there's a lot of different roles with the caregiver. Sometimes they are so hyper focused that they got to do all the research, and they live on the computer while the person goes through the treatment. So when the treatment ends, they're left also going like, well, I still got to keep doing this research. And the person who had cancer is just like, we're done. And the person is still like, no, I gotta, I gotta make sure you're doing all the things. And it's a balance of power, control, and it's that
Mhm.
powerlessness.
Right.
It's about letting go of control, and that's so hard for anybody. Illness, no illness, it doesn't matter. We want to feel like we're in control of our lives.
Yeah, it's a core emotional need, autonomy. Yeah, we want to feel control and
Yeah,
autonomous, and it's without it is when you start to feel helpless. Yeah,
yeah.
which I think is a good point
And
too, like
sometimes,
the helplessness is not necessarily because of the context of the situation. It's more about how much control, choice, and autonomy you have in the situation.
but the thing is, and I try to instill this, but it's hard. Like, not everybody is spiritual, and sometimes helplessness isn't totally helplessness. It's letting go.
Yeah.
But for
Yeah.
people who don't have something to let go to, let it go. I don't know. I'd still struggling with that one a little bit. So I kind of don't
Yeah.
go there as much. Because it's really hard having to control things all the time. It's a lot of work.
Yeah.
But
Yes.
I guess not everybody believes that there's something to let go to. So they have to control everything. And sometimes it's about letting the randomness of things happen the way they are is kind of where I go with it, because
Yeah.
having such a tight grip, I use a lot of I lose words. Unfortunately, that's the chemo result. Um, Metaphors. That's the word I'm looking for. I use a lot of metaphors. So I talk about the tightrope. When you're holding that tightrope, you're being dragged, and sometimes it just feels better to let go. You know,
Yeah.
or you
Makes
banging your
sense.
head on a wall. You stop banging your head. Hurts less.
Yes. When I think about letting go, I think, and what you're talking about with spirituality or religion or both, is spirituality and religion often gives people a foundation underneath them so that when they let go and they fall, they're being caught. And that's the visualization I help with people who are not religious or not spiritual. I'm like, that's okay if you don't believe in whatever, you don't believe in anything. But what is under your foundation? You get to create that. Like you have to create that, or else you can't let go because your body and your mind's not going to trust you to fall because there's nothing to catch you. So again, it doesn't have to be God, but
Yeah,
what is it?
yeah. What is it? The ether. It's something. Yeah,
Yeah.
that's a very good point. It's got to be something. So
Yeah.
yeah, it's a lot, and there's just so many different things, and it's just funny because, like I said before, you start out and it starts out being about cancer, but then it becomes other things. You know that maybe some of the things weren't an issue before because you were just used to it and you didn't know there was anything different. But once you're faced with a life altering disease, be it whatever it is, you kind of view life a little differently and like, yeah, I don't need to live the way I was. So let's explore these things. Let's explore these patterns, with my family of origin, and let's look at boundaries, and let's look at all these things that they've never been occurred to them before, So it's a lot of good work.
Yeah.
A lot of good
Absolutely.
work. You think, that's how all therapy is, isn't it? You come in for one thing and then it turns out to be something completely different a lot of the times.
Yeah. Yeah, it's funny because sometimes people will say like, I don't know how like you only work with chronic illness, and I'm like, well, I don't. Like even though every person on my caseload has a chronic illness, it's always an array of different things. Like it's family dynamics, it's medical trauma, but maybe also no medical trauma, and it's more about like work stress or there's so many different things. So yeah, I am with
Yeah,
you there.
and yeah, all the things like to manage illness, you have to manage all the other things, you know,
Right.
keep stress at a minimum and take care of yourself and be mindful and relax and sleep hygiene, all the things that when your head is spinning, you can't do all those things. And that's why everything's so intertwined.
Yeah. Yep. Absolutely. This has been a great conversation for me. I'm curious if there's anything else that you want to touch on before we end today.
I think I made myself little notes because I like not blank out, which is what I always
Yeah.
do. But yeah, no, I think we talked about a lot of the things of what I do and what working with cancer patients is like, you know. Um, and just to touch a little plug too, working with caregivers, it's not just Alzheimer's patients too. The families need a lot of help. So I work with that dynamic as well. And it's the same kind of thing now. They just need help getting through it and finding acceptance, you know?
Yeah. Absolutely.
So,
Great. So yeah, your practice is virtual in Florida, and people can find you at safewaterstherapy.com.
yeah.
Anything else
So
where
it's
people
virtual, virtual Florida, virtual New Jersey. I am looking to incorporate walk and talk with established patients. I'm considering home visits. That might be
Yeah.
something I'm picking up. I'm not sure. Because sometimes
Yeah.
people just aren't well and they still, the virtual connection, it's tough. It's tough. I
Yeah.
mean, it's good and it's good for some people who don't want to get off the couch, but I think even better is if I could come to them. So just working the kinks out on it.
Yeah. Awesome. Good. Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then.